are some common concerns you hear from patients when discussing lung cancer clinical trial options?
When I discuss clinical trials, the first question generally patients ask is, well, how effective is the drug, right? And the second question will be, well, what are the side effects? And those are very valid questions, but we may not always have an answer to it, especially if they're in early phase. I do a lot of early phase clinical trials, meaning, sometimes we don't even know the proper dose of the drug to use, for example. And the intent of the trial, for example, in phase 1 generally is to find out what is a proper dose to use that is safe and effective before we can do a test in phase 2 setting using the recommended dose to test it out more rigorously, how well it works. And if it passes phase 2, then we go to phase 3, which then generally is comparing it with the standard to see whether it will be better or at least equivalent or non-inferior. And you may ask, well, why even do a non-inferior? Because, well, some drugs, it may not prolong your life more than current therapies, but if it has better side effect profile, right? So there are actually drugs that are approved through non-inferiority trials. But those are the common concerns. And I think another common concern that I hear is, when I talk about trials, patients are concerned about receiving placebo.
And what do you tell patients?
Well, it depends on the design of the trial and the question that is being answered. So in fact, for example, some situations wherein the standard of care is not to do anything, the best way to remove bias is to administer placebo, because the standard care would be not to do anything. And those generally are phase 3, like early phase 1, phase 2, generally there are no placebo involved. I mean, there are some randomized phase 2 trials that there are placebo involved. And I explain to the patient why placebo may be involved, and it's usually on top of a standard of care. So there could be a standard of care therapy, but you add something else. So you want to compare it with a new drug plus the standard of care. So you might add placebo so that the doctors will not be biased when they measure their scans, for example. They say, oh, this patient is getting this experimental drug, so they're excited. They might make it look better than what it actually is.
As a researcher yourself, do you always know that a placebo is part of the clinical trial testing?
Yes, it will be in the design. So it will say there is a placebo control. So the title or the design generally will tell you this is a randomized, double-blind, placebo control. Usually, if there is a blinded, there might be some placebo involved, because then you don't know what people are getting.